Welcome, ladies and gentlemen. Today we're going to have a little talk about a very important topic regarding the microscopic parasite. This is about Giardia. Giardia causes the diarrheal illness known as giardiasis. Giardia also can have so many common names, and among these names we may mention the Giardia lampelia and Giardia intestinalis. Giardia can be found on surfaces or on soil, food or water that has been contaminated with feces from infected humans or animals. Giardia is also protected by an outer shell that allows it to survive outside for a long time. And that, of course, will make it tolerant to chlorine disinfection as well. While the parasite can be spread in different ways, drinking water or recreational water is the most common mode of transmission. And that's why it has been called or classified under the waterborne parasite. The general information I brought here, as you can see, the Giardia lampelia, sometimes called hikers, travelers disease, and we will see later why it has been given that certain name. The microscopic parasite can contaminate warm-blooded animals and people. The Giardia was also debugged by the World Health Organization as pathogens in year 1981. Giardia caused the disease known as giardiasis, which is an intestinal ailment, as it is found in the upper side of the intestinal tract. Giardia is the most regularly distinguished pathogens and waterborne ailment broke out in the U.S. history. The route of exposure mainly can be transmitted via the fecal-oral routes of exposure. The Giardia cyst also, when swallowed, people as a result can become infected. People who are at great risk, the traveler and the backpackers, as I have mentioned earlier, and the reason why they are at great risk because they usually drink water from lakes or rivers which are considered untreated. People in child care settings, people nearby, interaction with other people carrying the disease, people who swallow contaminated water, like in the example we have aforementioned with regard to the travelers. It may be chlorinated, but the chlorine, as we have also mentioned earlier, it's not efficient because of the parasites in terms of feces from animals which ends at the end of the river streams. So the filtration actually is missing in that situation, and the chlorination by itself cannot do anything, as we will see later. The next, people who have contact with the infected animals, and the last one is the homosexual between men. The health impact to humans may include the acute symptoms like diarrhea, stomach and abdominal cramps, dehydration. The others may include the loose weight, failure of absorbed fat, lactose, vitamin A and B12. In children, the situation looks even worse, as it can delay the physical and mental growth and cause the malnutrition. The life cycle of Giardia. If you still remember, we said the cysts are resistance form and are responsible for transmission of giardiasis. Both cysts and trophozoites can be found in the feces. The cysts are hardy and can survive several months in cold water. And the infection actually occurs by the ingestion of cysts in contaminated water, food, or by fecal oral routes, usually through the mechanisms of hands. And the small intestine excitation releases the trophozoites. Each cyst produces 2 trophozoites. The trophozoites multiplied by longitudinal binary fission, remaining the lumen of the proximal small bowel, where they can be free or attached to the mucosa by the ventral and the ventral sucking disc. Incestation occurs, on the other hand, as the parasite transit toward the colon. The cyst is the stage found most commonly in non-diarrheal feces. Because the cysts are infectious when passed in the stool or shortly forward, person-to-person transmission is possible. While animals are infected with Giardia, their importance as a reservoir is still unclear. Diagnosis and treatment for the human health. There are many drugs available that can be used to treat Giardia infection. And among these, we can mention the quinacrine, treated about 93% of patients, the metronidazole, which treated about 92% of patients, Frozolidone treated about 84% of patients. The diagnosis and treatment for drinking water, it may start with storage of raw water through sedimentation by creating bond where large suspended solids allowed to settle out by the action of gravity, and then pre-chlorination, and then coagulation through addition of chemicals like almond and ammonia to cause the microscopic particles to lump together, and then water softening through ion exchange, and then filtration, remove large particles resulted from the coagulation, including the Giardia cyst, disinfection, where we can use the chlorine to kill the viruses and pathogens, filtration and disinfection. Now I leave you with this short video and hope you will find it beneficial.
Giardia is a microscopic parasite that causes the diarrheal illness known as giardiasis. Giardia is found on surfaces or in soil, food, or water that has been contaminated with feces from infected humans or animals. Giardia cysts are protected by an outer shell that allows them to survive outside of the body for long periods of time, sometimes weeks or months, and makes them tolerant to chlorine disinfection. People can become infected by swallowing Giardia picked up from surfaces such as bathroom handles, changing tables, diaper pails, toys, and properties contaminated with sewage that contain feces from an infected person or animal. By drinking water or using ice made from water sources where Giardia may live. By swallowing water while swimming or playing in water where Giardia is present, especially in lakes, rivers, springs, ponds, and streams. By eating uncooked foods that contain Giardia. And by having contact with someone who is ill with the parasite. Symptoms of illness normally begin 1 to 3 weeks after becoming infected. In otherwise healthy people, symptoms of the illness may last 2 to 6 weeks. Occasionally, symptoms last longer. Prescription drugs are available to treat the condition. Although the Giardia parasite can infect all people, infants and pregnant women may be more likely to experience dehydration from the diarrhea caused by the organism. To prevent dehydration, infants and pregnant women should drink a lot of fluids while ill. Dehydration can be life-threatening for infants, so it is especially important that parents talk to their healthcare providers about treatment options. These are just a few things to know about Giardia. To learn more about this or other environmental, health and safety, occupational, or indoor environmental issues, please visit the website shown on the screen.
I'd like to thank you for watching this. Hope you like it, and thank you.